that India will become the first country in the world to dissociate healthcare from wealth. India will prove to the world that the wealth of the nation or wealth of the family has nothing to do with the quality of healthcare its citizens will enjoy. Now, all of you must be thinking, yes, it may happen after 50 years or 100 years. No, it is going to happen in the next 5 to 10 years. How it is going to happen? It will happen because of the two powerful forces which are emerging rapidly in India. One is technology in healthcare. That is the first one. Like many hospitals, we also started the journey of introducing technology in healthcare 20 years ago. And in 20 years, we have spent millions and millions of dollars, tried various models. In the end, we decided that if we have to have a digital platform delivering healthcare, we must do it ourselves. And in the last 8 years, some of the brightest minds in software engineering joined the entire mission, and they created a beautiful, what I would call a magical tool called Atma, which is a digital platform. Essentially, it is a platform like Android and iOS for delivering healthcare. And currently, about 16% of the heart surgery done across the country is done by our group, and entire service is based on this platform. Our belief is that when the patient enters the hospital, there will be reception without receptionist. Patients will register themselves and pay through their mobile phone or the kiosk or the online. There is no need for a receptionist. There will be intensive care units without the intensivist. Intensivist will be at home monitoring the patient, because every data what is coming from the patient will be analyzed by them. And there will not be so-called sudden cardiac arrest happening in the hospital, especially in a heart hospital, because 6 to 10 hours before the cardiac arrest, many subtle changes happens in the human body, and the human eye cannot detect it. But a simple sensor costing maybe a few hundred rupees, which is attached to the chest, can sense this, and the AI tools analyzes it, and that predicts the cardiac arrest 6 hours in advance. So a patient who will otherwise have a cardiac arrest in the ward will be shifted to the ICU. Even if they develop a cardiac arrest, it will happen in a controlled environment. Now, all these technologies took millions and millions of dollars. Now we have a dream. We have a dream that 80% of the hospitals across the world do not have electronic medical records. We want all these hospitals to have this electronic medical record. What difference it will make having a digital platform? What difference it will make in a hospital if you take away the pen and paper from the hands of doctors and nurses and technicians and replace it with the smart digital tool? What will happen is mortality, morbidity in the hospital will come down dramatically. How that will happen? According to the Joint Commission of US, 67% of the sentinel events happening in the hospital, which generally leads to the death of the patient, is due to communication failure. The blood test shows some deadly bacteria, but that doesn't reach the doctors on time. If 200 patients get admitted to an American hospital and spend just one night, American hospitals are considered as some of the safest hospitals on the planet. 1 in 200 dies due to medical error, not medical negligence. Getting admitted to an American hospital is 10 times riskier than skydiving. This is the data. Why medical error happens? Because of the communication failure. And once you have this digital platform, we can virtually eliminate the communication failure. So our dream is that every hospital should have it. Now you must be, I just want to ask you, how much you think this kind of platform called Epic, they sold it for $1.2 billion. You may not know how many zeros are there in billions. It is a huge sum of money. And we want our platform to be available to every hospital in the world at a price what they can afford to pay, and if they can't afford to pay, they don't need to pay. We have started giving this platform to hospitals. There is a 200-300 bed hospital in Ranipet called Skadar Hospital, which is a busy hospital, mission hospital. We gave them the software. They became paperless in no time, and 3 months after started using it, the CEO of hospital came to thank us. He asked me a question: why did you give this platform to us free of cost? It cost you so much of money. I told him that if I didn't give you, I wouldn't be richer than what I am. This is the beauty of converting atoms into bytes. India at the forefront, ahead of any other country in the world, is the steps taken by Insurance Regulatory Authority in allowing hospitals like us to become health insurance company. That will have a massive impact. Now, you must be knowing that there are insurances, health insurance available. Why large number of people are not buying the health insurance? Today, there are three important stakeholders in healthcare. First one is the hospital, second one is the health insurance company, and the third stakeholder is the patient. Hospitals do not trust the health insurance company. Health insurance company doesn't trust the hospitals. And the patient doesn't trust both parties. And those two parties don't trust the patient. So we have a system in which there are three important stakeholders. They don't trust each other. In any business, if all the three important stakeholders don't trust each other, that business cannot thrive, that cannot grow, that cannot scale up. Now, what happens when the hospital becomes a health insurance company? As I said, today about 16% of the heart surgery of India is done by our group. More people develop heart attack, it is better for my business. I have no incentive in preventing people from developing the heart attack. But when I become a health insurance company, my interest is to prevent people from developing heart attack. Then my interest and the customer interest is aligned. When that happens, business will grow. Today, when I tell a patient that you need a bypass grafting, first thing what goes to their mind is it really required? Or he wants to make some money out of me. But when I become a health insurance company and I tell the patient that you need a bypass grafting, there is no conflict because we are going to pay for it. All this transformation will not take years and years. We have launched a health insurance. Our dream is that we have 100 million missing middle families in the country who earn between 20,000 rupees to 60,000 rupees. If they admit their parents or a child or relative to a hospital, they will not be able to bear the cost even for 3 days in a private hospital.